See, as you all know, Takayasu's arteritis is a large vessel vasculitis affecting the aorta and its major branches, and is more common in Asians. It's common in young and particularly females. All over the world, females are much more common than males in the disease called Takayasu's arteritis that we call as aortoarteritis or non-specific aortoarteritis. Since this is a case-based learning, I shall present this first case, which was a 24-year-old female. She presented to us with syncope and pre-syncope for last 8 months, angina and dyspnea on exertion of the same duration. And echocardiography showed dilated left ventricle with severe left ventricular dysfunction with poor left ventricular ejection fraction and moderate aortic regurgitation. Patient had raised activity markers in the form of raised ESR and raised CRP positive. As you can see from the angiogram which has been shown here, the digital subtraction angiogram, it shows total occlusion. Is there an arrow here? So it shows total severe stenosis of the arch vessels. You can see the severe stenosis of the carotid arteries, the vertebral arteries and the subclavian arteries. The coronary angiogram showed tight left main stenosis at the ostium. So, and while the other coronary arteries were normal. So as can be seen, this patient has severe stenosis of multiple arch vessels as well as renal artery stenosis. So what should be done for this subgroup of patient? Particularly important is the treatment of activity of this disease. As you know that this patient had raised ESR and CRP positive, which are the well-known markers of activity of the disease. The first treatment in this patient is the treatment of activity, that is the initial treatment with the help of glucocorticoids, and nowadays it has recommended that the 2 drugs, as you are treating hypertensive patient with 2 drugs, similarly the activity also should be initially started with the help of 2 drugs, glucocorticoids with methotrexate or glucocorticoids with mycophenolate. 1 drug is usually not enough, and the time required for reducing the activity is long. So long-term treatment of this disease is required by these anti-immunosuppressive agents. As you have seen in this case also, the multiple arteries and multiple sites are commonly involved in these cases, and this the intravascular ultrasound which we did in this patient showed that there is dense transmural fibrosis. You can see here that there is dense transmural fibrosis. The whole artery is almost totally fibrosed, so difficult to dilate. It requires very high infiltration pressure for dilatation because of this dense transmural fibrosis. And commonly there is dissection in the artery which is dilated with the help of balloon. So these are the common problems encountered. And because of the multiple sites of involvement, multiple arteries at different sites, like in this patient had stenosis of the arch vessels, renal arteries, coronary arteries. So surgery is also very difficult because the whole body has different types of stenosis. But surgery has special place in those patients who have long segment stenosis, like this patient who had, you can see here, down from thoracic aorta to abdominal aorta is severely stenosed, as well as the renal arteries are severely stenosed. So surgery has place in this, and total occlusions and aneurysms also are another subgroup patient which requires the surgical approach. This slide shows that this patient had severe stenosis of the thoracic aorta, and which was after balloon angioplasty was dilated effectively. And the lower panel you can see the longer segment stenosis was dilated, but the relief was not that significant. Another important thing that we have found in last 3.5 decades of our experience with this angioplasty is that sometimes after balloon dilatation, the patient can develop dissection, and then you have to do a stent implantation in these patients to relieve their obstruction completely. We started our balloon angioplasty interventions in Takayasu's arteritis in 1985. Now it is more than 35 years. We published our initial experience in Circulation 1987, and then we published a large experience in American Heart Journal 1992. The follow-up results showed that these patients often have symptoms of hypertension and left ventricular dysfunction. As you can see here, this patient with severe stenosis of the thoracic aorta had severe left ventricular dysfunction After balloon angioplasty, as the thoracic aorta opened up, the left ventricular dysfunction also got relieved in next 3 to 6 months. The ejection fraction, which was 20 to 25% initially, became normal. So this is another very important use of treatment of these balloon angioplasty. Often the renal arteries are involved, particularly in the Asian patients, Indian patients. Renal arteries are very commonly involved, and often the involvement is bilateral. And as you can see here, mostly the ostium segment of the artery is involved, and after balloon angioplasty can effectively relieve the renal artery stenosis, because these patients often have severe hypertension, which causes congestive heart failure, renal ischemia, and then these patients can go into renal failure. So revascularization of these renal arteries is very important. So first mode of treatment is balloon angioplasty in these patients, making the revascularization mandatory. Also, we had published the largest series in the world of balloon angioplasty for renovascular hypertension in children in 1997 in Pediatrics, which is the official journal of American Society of Pediatrics, which showed that Takayasu arteritis is the commonest cause of renovascular hypertension in Indian children, as compared to fibromuscular dysplasia, which is the commonest cause of renovascular hypertension in the Western population. You must remember that Takayasu arteritis is the commonest cause of renovascular hypertension in Indian children. It requires high inflation pressure for dilatation, and restenosis is also more common, but can be redilated again in these patients. We have published the long-term results of these patients on follow-up. Like this patient underwent balloon angioplasty for the renal arteries and the thoracic aorta, and follow-up also showed that artery had further improved, and on follow-up in now almost 25 years, the patient continues to do well without any requirement of antihypertensive medication. Another important problem in these patients is arch artery involvement. Balloon angioplasty is very effective in these patients with arch artery involvement. As you can see here, this patient had symptom of recurrent syncope, and patient could not sit up without developing syncope, had total occlusion of all the arch vessels. Balloon angioplasty supported with the stent could revascularize her brain, and her symptoms of syncope subsided. Coming back to our index patient, the balloon angioplasty was performed, followed by stent implantation in this patient of the carotid arteries and the vertebral arteries to open up the carotid and vertebral arteries. And after balloon angioplasty and stent implantation, you can see the artery has become almost normal, and patient was continued on the anti-inflammatory and antiplatelet treatment, along with the renal angioplasty was also done. This patient had ejection fraction of 30 to 35%, and after balloon angioplasty now, on follow-up, this patient has an ejection fraction of 60%. So balloon angioplasty is very safe and effective. Later on, we also did the angioplasty of the left main coronary artery stenosis, relieving her of angina. This is another example from patient who had a problem of her vision. She could not see. As soon as she used to sit up, she used to become blind. She had total occlusion of all the arch vessels. You can see here the subclavian artery, the innominate artery, and the vertebral arteries are totally occluded. And these balloon angioplasty was performed in the patient, first of the subclavian and the vertebral artery, and this subclavian to vertebral artery stent implantation was done, and some blood flow was restored to the brain, and patient could now see, though some revascularization was sufficient to relieve her symptom. This is the first case in the world of balloon angioplasty of pulmonary arteries. Like you see, the pulmonary arteries are also involved in patients of Takayasu arteritis. We perform balloon angioplasty along with stent implantation, and relieving her symptom of pulmonary artery hypertension, improving the blood flow to the lungs, and improving the symptoms of pulmonary circulation. Also, the patient had severe stenosis of the carotid artery, which could also be relieved with the help of balloon angioplasty and stent implantation. So, friends, to conclude, the patients with Takayasu arteritis initially need medical management, and glucocorticoids are still the mainstay of treatment. As the relapses are common and glucocorticoid drugs are required long term, so early introduction of glucocorticoid steroid agents such as methotrexate and mycophenolate are initially started now in these patients, and are given long term along with the glucocorticoids, while watching for the activity of the disease with the help of the activity markers. And often the MRI is also very effective in judging the activity of the disease in these patients. Refractory cases where these treatment is not effective, biologics have been found to be very effective in relieving the activity. The TNF alpha inhibitors, infliximab, an interleukin-6 inhibitor, that the tocilizumab, which was widely used in COVID, has been found to be very effective in about 80% of these patients. Newer drugs, JAK inhibitors, are also shown to be promising. But in those patients who have severe vascular ischemia, revascularization is mandatory, whether by endovascular approach or surgical approach, but endovascular approach being preferred because multiple arteries can be treated in a single sitting, and if restenosis occurs, repeat angioplasty can be performed effectively in these subgroup patients. Surgery is reserved for those patients with total occlusions, long segment occlusions, and aneurysms. Thank you very much for your patient listening.